Hello and welcome to World Talks on TVP World with me, Ashim Kumar. Today we're joined by Dr. Paweł Grzesiowski, Chief Health Inspector of Poland, to discuss growing public health concerns in the country. From the alarming resurgence of vaccine-preventable diseases like measles and cholera to the sharp rise in Lyme disease caused by tick bites. Poland's health landscape is facing multiple threats. With vaccination rates dropping and infections creeping back into the population, Dr. Grzesiowski offers insight into what must be done to protect public health. Doctor, welcome to TV World and thank you for taking the time.
Thank you for inviting me.
It's a pleasure, sir. So, cholera, measles, these were things I remember from my childhood. You know, you were vaccinated and then you forgot all about it. It had pretty much vanished and now it's back. Why?
This is a quite complicated story because there is no one factor deciding which disease will be active in certain country or in certain time. We have to remember that all infectious diseases are under control if we are immune against the disease. And if our immunity is waning, if our immunity is not present because of lack of, for example, lack of vaccination, the bacteria or viruses, they could attack and they are successful.
But they have to come from somewhere, right? People stopped, I guess, taking the vaccinations or having the vaccinations for cholera and measles a while ago, and they still were okay.
I would stress that the cholera is different disease than measles, because measles is still present in Europe.
Right.
We have several hundred cases, like last year more than 200 cases, this year like 50 cases.
Okay.
This is not much, but still the disease, the virus is present in the community. And we still keep this virus under control because of vaccination and rapid diagnosis, isolation of patients. So we have to do this all the time because the virus is still circulating in the population. But cholera is different disease because in Europe we don't have active cases of cholera, like domestic cases. In the last 2-3 years, it was something like 50 cases of cholera, but all were imported from Africa or South Asia. So the domestic cases of cholera are not present, so we don't vaccinate people in Poland against cholera because there is no need, there is no indication for that. We only vaccinate against cholera people traveling to countries when cholera is active.
Okay, so it sounds as though what you're saying is that basically the migration of people from Asia and Africa is part of the issue, and that's of course all types of migration. Is there any way that these people can be checked for, whether they're carrying or make sure that they're vaccinated before they come?
This is very important question, but also political, because we have to think that if we plan to check health status of people coming out from abroad, we have first spend money for that, and second, we have to build the system. When someone is crossing the border, it should be the diagnostics should be done quickly. We have other diseases like tuberculosis, which is very nasty disease, sometimes without clear symptoms, but after a few months the disease could evaluate in active form. We have HIV disease, which is in the early stage, completely without symptoms. So we have to think which country the foreigner is from, and then try to build the diagnostic tool specific for the country, for the risks, health risk in this country.
Understood. Now, as well as cholera, you mentioned HIV and tuberculosis. Are those on the rise as well in Poland?
Tuberculosis is still, I can say, unstable, because during last 5 years we saw increase in number of cases, especially, which is really dangerous, tuberculosis resistant to antibiotics. This disease is much more devastating because we have no drugs.
And where's
no
it coming
medicines.
from?
Mainly from South Asia.
So the same source, basically.
Yes, exactly.
Understood. Now, so I mean that's political in itself. I mean, there's a big debate on migration and how to cut that off, illegal migration especially. How well is Poland's health infrastructure prepared to deal with what we're seeing at the moment?
Well, we try to keep this under control, but still, from my opinion, this is not a systematic way, because people traveling into Poland, if they concern to work here, they will probably be checked by the physicians sometime. But if people cross the border, not being the part of working force, no one knows where they come and where they go and when they will cross the border again.
Right.
So this is the problem. We don't have the system identification of foreigners crossing the border for different reasons.
Because there is the other risk, of course. This is obviously going to spread amongst the population, and so suddenly there is a problem you cannot ignore any longer.
Absolutely.
And on top of that, of course, people are kind of shying away from taking vaccinations. I mean, there was a big, resistance to the COVID vaccination, for example, and I think that may have put people off from taking vaccinations. Do you agree?
We checked this. I personally did some studies about this problem, whether the COVID vaccination put people more against or more pro-vaccination, and this is equal. Some people decided not to vaccinate after pandemics against other diseases. Some people were even more active in searching of vaccination, and the difference is mainly the age of people. So older people, they are more conscious about infectious diseases.
Right.
They want to protect better their life, and younger people that are more risky, and they think that COVID was not so bad for young people, so there was no need to vaccinate.
Understood.
So this is the reason why this
there is
population is divided. Yes.
Yeah, I mean, it's a fascinating social question as well, is it not? I'd like to move on to Lyme disease, as carried by ticks. Now, we all know that in summertime you go into the forest, there's always a risk that a tick's going to jump on you, or perhaps your pet, your dog. So, you're advised to check. But the number seems to have grown, the number of, tick-borne diseases, Lyme disease, for example. And on top of that, it's not just the forest anymore. It's happening in the city. What's happening there?
We have to remember that ticks are traveling with wild animals. And we have wild animals in our cities. So you can see different animals traveling during the night, and they are feeding ticks. So this is why in Warsaw, Kraków, Poznań, or Wrocław, you can be bitten by a tick without any travel, any visit in the forest. So this is the problem, that we have very close contact now with normal environment of ticks. So they could even spread in parks, in your garden.
So they're everywhere.
They are everywhere.
Can we protect ourselves? I mean, can we vaccinate, for example, against Lyme disease?
So we have one vaccine which is very effective against tick-borne encephalitis. This is virus carried by ticks, and we can protect ourselves by vaccination. But we have no active available vaccine against borreliosis, which is called Lyme disease. There are some prototypes during clinical trials, but still we have no available on the medical market anti-Borrelia vaccine. We are waiting for that, but still we have to protect without any pharmaceutical measures, like protection of our body, sprays and things like that. Yeah.
Prevention is infinitely better than cure, because right now there isn't a cure.
And after being bitten by tick, we have to remember that we should first think about symptoms. This is the skin symptoms, mainly the rash, the rash which could be in place of the bite. And also we should follow the diagnostics. We can take blood after a few weeks after bite, and we can measure level of antibodies against Borrelia. If they are high, we have to take medicines, antibiotics.
Understand. Now, there's another element to this which is slightly worrying, and that there are reports that there is an influx of exotic ticks, if such a thing exists, coming from Africa. How?
They travel with products. We have a lot of products from Africa, Asia, and ticks travel with these products. So the market is so global that we can expect everything.
Yeah, but that's not new, is it? I mean, but these African ticks are new, so something must have changed.
Yes, probably. I'm not sure, because still we are trying to find these ticks in Poland. There are some reports that they are present, but probably also it could be the way how the climate is changing, how the environment is changing. So that's why we call this this idea One Health, because we have to care about the environment, the water, forest, and it could be also important concerning different species of animals coming to Poland. Yeah?
So it certainly sounds like we have to take a holistic approach, both in terms of weather and vaccinations and political issues as well.
Absolutely.
Doctor, thank you very much indeed for sharing your analysis with our audience, and most interesting.
Thank you very much for inviting me, and very interesting dialogue.
Thank you. Well, I certainly enjoyed it. And that brings us to the end of this episode of World Talks. Don't go away, though. Lots more coming up. Goodbye.